Alright, today I'm going to be showing you how to place a dental dam. First, we're going to go over what should be in the kit for this procedure. Obviously, we'd have the explorer and the mirror just to make sure we have everything. Also, for this particular dental dam forceps, dental dam punch, the dental dam frame, the dental dam clamp, the stabilization cord or the wedget, floss, which I don't have floss in my house, so I'll be using this, and then the dental dam material and the guide. Okay, first, since we know we're doing tooth number 29, we are going to take the dental dam material, oops, if I can get it right, and then you're going to set it on your guide. I already did this ahead of time, but so you would place it, you do the tooth before, which would be tooth 30, on a hole 5 punch with your dental dam punch. Then you'd move down to punch number 3 and then punch 3 for hole tooth 29, 28, and 27. After you have that done, you can leave it there, and then you're going to use wood tie floss. I do not have floss at my house or in my kit, but I need to add some, obviously. So you would tie the floss and bring it on the side, and then do a loop where you would take the 2 strings of the floss and loop it through on this side. That way, pull it tight so it's easier to remove. Then you would take your cotton forceps and get the clamp and place it on tooth number 30, right above the tooth that we're working on. You want to make sure that it's nice and straight and facing and it's secure. Then, after that, you're going to take your material, you're going to take the biggest hole in the 2-step procedure, and you're going to stretch it over the clamp and over the wings. I'm going to make sure it's coming down behind as well and gets in between the teeth, so you know that it's working and that no material is going to leak into the gums. When you're finished with that, it's easier, I've found, to then place the frame kind of hard when you're filming yourself, but just making sure that it's stretched out on the sides, so then you can get it around the other teeth. As well. Alright. Then I'm going to kind of work, make sure it gets on tooth 28 all around, and then tooth 27. And do the final stretch. The material breaks. It's usually not a big deal if it's broken on the ends, but you just want to make sure that it's not broken anywhere inside of here so that there's no leakage. There we go. Okay, notice how some of the material is coming up here. Want to make sure it's down in those teeth. So that's when you would take your floss, kind of work it down there, meeting the gums. Okay. Then, since it keeps creeping up on tooth number 27, you can use your wedge it material. Get it down in there so you know that it's not going to pop up. You would use scissors to cut the excess material so the patient's nice and comfortable. Make sure it's all down. Alright. Alright. Looking good. Also, you can use a non-sharp instrument like a scapula, just spatula, not a scapula, a spatula, and make sure that everything's nice and down toward the gingiva and it's not coming up on the tooth, because we wouldn't want anything to get down in the gingiva while we're doing the procedure. So everything looks good. Okay. So once everything's all set up right and looking good, to take off the dental dam, first you're going to take off this thick wedge it material. So you're going to hold it. It's kind of like a rubber band, so you wouldn't want it to snap in your patient's mouth, because that wouldn't not feel very good. So you just kind of pull up on it, but make sure you have a really tight grip just so it doesn't snap. Then, oh dear, you're going to remove, you can remove the frame if you think that's easier, which I do, because then it's not in the way. And then you're going to use your universal scissors that go in the mouth, in which I also do not have in my kit. So we're going to pretend. And what you want to do is you want to make sure and pull the material out from the mouth. So you're kind of exposing those holes. So you can kind of see the gingiva, just like this. And then you're just going to take 3 little snips, snip, 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 making sure that you're not cutting your patient's mouth, you're just cutting the material away. Okay. It's kind of harder with bigger scissors, but okay. Then you're going to take your dental dam forceps. You're going to place them in the holes of the clamp, like so. And you're just going to remove the clamp. Set it over this side. Then you can just take the material off. Should be nice and easy. And you're wanting to make sure not to let this splash everywhere. Just take it off. Make sure that you kind of have all of your pieces. For me, I do see one piece in the teeth. So I'm going to grab my regular floss. Which is right here. And then you just want to make sure that there's no excess material. If you do see some, make sure to get it out of your patient's mouth. See, like right here, this little bit of material is left in there, and just kind of floss in between. Make sure everything feels comfortable. Notice there's no more. You can look with your mirror just to double check. See how everything looks. And then you're good to go.